Welcome to Infectious Laughter Podcast.
Hosted by nurses, where real, ridiculous, and relatable moments from working in healthcare are shared.
We respect HIPAA because it's real, and we like our licenses. Now let's do this with culture and sensitivity. All right, Nancy Pants. Here we are, episode 5-ish. And we say ish because we're not sure.
Right.
We titled this. It was going to fall off anyway.
Yeah, that happens a lot.
Yeah. And I'm going to tell you a joke that was one of the first inappropriate jokes I ever heard.
Okay.
It was my uncle. And it was probably a holiday. And his parents were there, my grandparents, my mother, his sister, my dad. For you,
a young man,
Mr. So-and-so.
And
he says, well,
after traveling overseas.
I did some really inappropriate things with women, many women, throughout my travels. And then I noticed that parts of me down below were changing colors.
That's probably not a good thing.
No. So he went to one doctor in one country, and he said he recommended a penile amputation specifically.
That's probably not a good thing.
And he's like, no, I can't do that. And then he went to another country and asked for advice, and he got the same advice. Until he now has had 5 people saying this is what you need. And so now he's come to the office, and his doctor examines him, and he orders some blood tests and swabs and things, and he brings the guy back for a follow-up appointment, and he goes, I have good news, Mr. So-and-so. We don't need to amputate. And he says, he goes, so what do we do? He goes, we don't worry about it. It was going to fall off anyway.
Pa-dum-pum.
Anyway.
And that's a good segue.
Right? But we're not talking about STIs.
No.
Sexually transmitted infections today. We're talking about diabetic feet.
Which we see a lot of. More and more over the years.
Yeah, the rates of diabetes are high. Yeah.
So what is a diabetic foot?
Okay. So one of the most common consultations in the hospital for infectious disease would be a diabetic foot infection, specifically, or a diabetic foot ulcer, a DFI or a DFU. And what can happen is diabetics will get wounds and they don't heal very well. And they also don't necessarily know they have a wound because they have peripheral neuropathy.
They've lost feeling.
Or numbness, tingling, and and they may have some sensation, and they think the sensation is intact, but it's actually not.
Right. Sometimes there's a burning feeling.
I did a quick review for myself, and the main thing when we talk about a toe, for example, that's going to fall off is due to gangrene. So it's black, there's dry gangrene, and there's wet gangrene.
And the black is from necrosis, which just means dead tissue.
Right. So the reason that diabetics get these, and even people with really bad vascular blood flow, but we're talking about diabetics.
Vascular insufficiency?
Yeah, I know. Thank you. So sometimes I hesitate because I'm going to use a nursing word, and then I don't know if I just should use a regular people word or a nursing word.
Well, then use both words, because that
that's
teaches.
what we're doing. Fair.
Yeah.
So diabetics do get the peripheral neuropathy, like we said. They get peripheral arterial disease and impaired microcirculation.
And peripheral venous disease,
And they have increased susceptibility to infection, which...
Among other things, yes.
Right. And that leads to compromised tissue viability or healing.
Right.
So I wanted to quick sum up why that happens to diabetics. So this is what I wrote down.
Right.
I wrote chronic hyperglycemia, a.k.a.
high blood sugar.
Right. And chronic being long-term.
Mm-hmm.
Impairs immune function, increases susceptibility to infection and tissue necrosis, a.k.a. dead tissue.
Right.
So basically, uncontrolled diabetics have an increase of infection that can progress to gangrene.
Right. Among other things.
Sure.
I We have a lot of diabetic patients. People with diabetes often don't follow their doctor's advice. Maybe they don't take their medications or give themselves insulin or eat properly, because until it gets really bad or the blood sugar gets really high, they can't feel it.
Right, they don't feel sick.
Right. So I use a very simple analogy to explain to them why damage is done to the body.
Oh, give it to me.
You know what syrup is like, pancake syrup.
Yes, Nancy, I do.
It's sugary. It's very thick. And the little teeny tiny blood vessels called capillaries that supply oxygen and nutrients to individual cells, to all the tissues. When the blood is thick like that, this is very simplified, but over the years, those cells and tissues die. And that is why over the years, diabetics have blindness, heart disease, kidney failure, they get the wounds. They eventually sometimes have to have their legs amputated. I always tell the men erectile dysfunction comes from that as well. 99% of all dialysis patients have either had blood sugars out of control over the years or blood pressure out of control over the years, or both. And again, blood pressure is something you can't feel until it gets really bad also. But over the years, those tissues die.
Right, 100%. So the analogy that I use with patients is if you imagine the veins and arteries in your body are garden hoses, and your blood is going through the garden hoses. So blood sugar is like sand in the garden hose. And the more sand that is taking up the space of that blood is doing damage along the garden hose.
Mm-hmm.
And eats away at those areas. Now, smaller areas, so your nerves very far away from your brain, say in your feet, are smaller. The veins very far away from the heart, say in your feet, are smaller. Yes. And then, of course, you're saying the capillaries, which is every cell, to include your immune function cells,
right.
Which is why, your immune system can dysregulate.
Right.
So I said, you're running all that sand and that damage is happening. And of course, if you take control of your blood sugar, you have less sand, but the damage to the garden hose is done.
Right.
We just don't want more damage.
More damage. Right.
Yeah. So
my question is always, a lot of times it'll start with the toes. Then they'll do what's called a transmetatarsal amputation, which is across the top of the foot. Then it's a below the knee. Then it's an above the knee amputation. And sometimes, you would think once the first amputation happens, you might do something about it. But often, no. And they come back and have more and more amputated.
Yeah, and I think it's hard because by the time, generally, now I'm seeing younger and younger patients get amputations, by the time the diabetic has been so out of control, and they may not because they didn't have preventive care, routine physicals where they draw blood to even know if your blood sugar was elevated, because like you said, they did, and they feel okay.
Right.
So that's a plug for preventive care.
Right.
Routine blood work helps to be able to afford that, to have insurance coverage or to have a plan that you can afford so that you can get preventive care so that long term, maybe it doesn't fall off anyway, right?
Right.
So they don't know, but also their dietary habits are so set in stone, and that's a hard thing to change.
Yes. And although there is a genetic predisposition sometimes, I think that one of the reasons it runs in families is because families eat the same.
Sure. And they emotionally handle life with food at times. You have, I had this one diabetic recently, and he says, I'm just addicted to soda.
Mm.
And I said, well, we need to not be drinking that and become addicted to water.
Right. Yeah. There's not a stigma against drinking soda like there is at maybe smoking or drinking alcohol or there's not a stigma.
Sure. And I'm not saying the average person cannot have a soda, but if you're an uncontrolled diabetic, that's a bad idea.
Right.
Yeah. So the other thing I say with patients when they have an infection, why does an infection go from nothing to something so fast?
Mm-hmm.
Is I will say, well, bacteria needs generally fuel, and that extra blood sugar that your body is not burning for energy is feeding that bacteria.
Bacteria love sugar.
And we need to shut down that frat party.
Right.
Now, my children are starting to go to college or in college now, and so I'm going to have to come up with a different analogy than frat party, but generally people understand.
Yes.
You know, sometimes I say Super Bowl party, but
Right.
I don't think that's as funny.
So what brought this up? What?
Yeah. So, you and I had a brainstorm session, and we were, let's talk about moments where you're like, what? So
Okay.
I'd had a conversation with a coworker of mine about the story that I'm going to tell in a minute. And we were also talking about, diabetic feet and toes, and it's just such a problem. And he told me when he was a nurse on the floor dealing with a patient, young nurse, and we're supposed to do a head-to-toe assessment on all the patients, right? For sure, I rely 100% on the nurses doing that. I need to know, do they have a wound on their backside? Do they, rash? Whatever these things. So he did a head-to-toe assessment of a patient who came in for a diabetic foot infection. And the patient had jerry-rigged this dressing, and so the patient took everything off, and as he was taking the last thing, and he was kind of holding the toe, and came off.
Toe popped off.
Yeah. And he didn't know what to do. So he kind of put it there like it was in place and wrapped it back up.
Oh.
And then went to go find someone to...
It's not going to stick.
No, but I think he was like, ah!
Right.
So...
Well, if you've been a nurse for any amount of time, you've had a patient who's lost a toe. For me, it wasn't a diabetic patient. It was a patient who had non-therapeutic maggots. But that's another story for another day.
That is another story for another day. Yes. So, but generally, the patients come to us, and they either require an amputation from a podiatrist,
right,
or they're being very closely monitored because it will just come off on its own.
Yeah.
So I was, doing my rounds, and I get a consultation for a diabetic toe infection. And I walk in, and there's an elderly patient there, and one of their children is there. And the patient begins telling me this story. Yes. Thank you.
Yeah.
So I'm trying to hippize it. And he had, I blew it. They had already lost a toe. At another point, we required an amputation because it was developing gangrene. So said patient had another toe, not doing well. I think it was his fourth toe. And he watched it. Dang it. It was the guy, obviously. He watched it. And he watched it. And he thought, why do I need to go to the hospital and pay money?
Right.
To have them cut this off. So he got some kitchen shears or garden shears, but I'm pretty sure he said kitchen shears. And he attempted to amputate his own toe.
Yeah.
And
how'd that work out?
Not well. Nancy, not well. Now, he had really no blood flow to the toe.
Right.
Which is one of the reasons why I was dying. So it didn't bleed. But it wasn't fully dry gangrene. There's
bone there as well.
Yeah, and muscle. I mean, not a lot of muscle in toe, but tendon. So I look over at the adult child, and they're just sitting there like, yep, no big deal. Makes sense to me. And I thought, if one of my parents comes to the hospital and is telling this story, I would be like, God.
Didn't this patient ask their adult child at home to assist them?
He didn't. But they were sitting there and just like this was normal.
Right.
You know, I mean, I don't think I would tell my parent not to share that story because you need to tell.
Right.
But I would have said, like, come on, Dad, like, that doesn't make sense. Why would you do that? You know, I would have responses, even if I'd already had those responses, because I want to kind of show the provider, like, I didn't stand behind this.
Right.
But by not really reacting, either they thought this was a good idea too, or they knew about it.
This is a good example of how the average person doesn't truly understand how the body works and how it's connected and what the ramifications are.
100%, because he got a high fever,
Right.
and introduced
Did
more
he
bacteria.
even clean the kitchen chairs first?
Oh, girl, I didn't ask that question. So, that's a great question. Or even clean his foot first.
Right.
You know, because even when we're amputating something, it's in a sterile field.
Right.
You know,
It's
you
been
wanna-
betadined to death. Well,
It's already dead. But the rest of the foot has
Right.
been cleaned.
Right.
And there's
the
wound
utensils
care.
are sterilized and the...
You know, maybe wound care was the bone next to the toe bone, the metatarsal. Was that infected as well? Who knows? So he just thought, well, this happened to me once, and this is what they did, so I'm going to do it. And I kind of had a moment where I said, oh, all right, so now you're here, and we're waiting for the podiatrist to see you, and I'll have you on IV antibiotics because we want to try to beat down any potential spread of infection that is now happening. It could go to your blood and cause sepsis.
Right. That's the main concern.
Right. So if bacteria is getting in your blood, it means it's getting everywhere.
Right. The blood, by the way, is supposed to be sterile.
Oh, you're talking about the blood in their body.
Yes. The blood in your body is supposed to be sterile. There's not supposed to be bacteria in it.
Yeah. Now, amazingly, you can get little micro bacteria that your body just clears anyway.
Right.
Right.
If you have a localized, if you get a cut, that's where the white blood cells come. That's, it scabs over. Your body can fight infection to a point.
Right. So then you get the fever, and that's like something's going on. That's, maybe needs some attention, especially if you have an infection that you can,
right,
not amputate yourself, which is all of them. You cannot amputate them yourselves.
I was even squeamish when I was younger about people pulling out their own teeth. So amputating someone's own toe is just beyond the realm for me.
I will tell you, what drives me crazier than anything with kids is when their toe, gosh, Nancy. Their toes are fine, hopefully, when they're little.
Right.
It's when their teeth are kind of like hanging there.
Oh, yeah.
So
can they wobble it back and forth?
Come on. Don't you want the tooth fairy to come? And that's gross.
Yeah.
Now,
as nurses, we can see a lot of weird stuff.
Yeah, but that needs to come on now. For my boys, I was not going to take that. And so when it got kind of to that point, I tied, maybe don't do this at home, right?
Right.
This is what I did. I took floss and I did a loop and I put it around that tooth and the floss and voila, the tooth is out. Oh, okay. So my best friend is going to roll her eyes because she doesn't want to deal with those teeth and is fine with them hanging all out. I don't know.
It is just going to fall out anyway.
The tooth is just going to fall out anyway. Now, sometimes, they need to be surgically removed. But the best part of this, I'm not even done with this guy, Nancy.
Okay.
Is when I said, we're going to wait for surgery, blah, blah, blah. And he's like, I start to leave and he goes, hey. And I said, yes, sir. And he says, I get a half discount, right? Because I already started the job for the surgeon.
And he was serious.
Yeah. I imagine so.
Well,
the way he said it wasn't, ha ha ha, and then their kid didn't laugh.
Right.
Looking all serious.
So he wanted to discount on the surgery, but now he's got the whole cost of the sepsis, the internal infection.
Right. It's way worse than it would have been. clearly he's not going for routine foot care, which all diabetics should have a podiatrist they follow with regularly. I've started to tell a lot of my diabetics, you need to check.
Look at your feet.
You're always told to check your feet every day, and some of them kind of look at me like, "Oh, I've heard that. I can't see them on my feet or whatever." And they're getting older, and it's hard to look. And so I say, "Look, go
have somebody else look at them."
Fair, but Nancy, I've been married almost 22.
Mm-hmm.
Wait, at least 22 years, and I don't want to look at the bottom of my husband's feet. Like, it's just so sick. I get that. But also, I would, of course, but I don't want to.
Right.
And I say, go, if their vision's okay,
mm-hmm.
go to the auto parts store and get one of those mirrors that they use when they're changing the oil and checking things. Because it's kind of on a pole.
Right.
And you can...
It's like a giant dental mirror.
Yeah. And then it's... it's not as expensive as a lot of the medical equipment. It's at an auto place. It's not super expensive.
Right.
So that's my new little tip. And I think maybe one of my PT/OT friends told me about that.
Mm-hmm.
So, yeah. So, what did I say to this guy? I think I said, either I replied with, look, the price of your admission and your surgery is above my pay grade.
Right.
Or I said, well, sir, that's not the way that works. And left. But he let me take a picture of his foot to have.
Oh, okay.
Yeah, I can't show it to you right now because my phone is...
If he was limber enough to be able to cut off his own toe, couldn't he see it?
Yeah, I don't think his problem was he couldn't see his feet.
Oh.
Okay. I just really think he was just like, whatever, it's just a toe. I had another one amputated and I can walk fine.
Right.
And then probably at his age, there's so much damage to all of that vasculature and nerves and...
But again, next is the transmetatarsal, and then the below the knee, and then...
Sure, so now you want to be very careful to catch something early so that you don't need further amputation. Even when the damage is done, we can hopefully catch things early. If you see something on your foot, get to the doctor, get it together. Yeah. So it was going to fall off anyway, Nancy.
Well, that's not reason enough to cut off your own toe.
No, God, nobody do that. Nobody do that.
No.
Yeah. And, and don't sleep around with a lot of women as you travel around the world. And if you do that, wear a condom, for God's sake.
Absolutely.
100%.
Yes.
All right, Nancy, we're saving the world, man.
Yes.
Okay.
One toe at a time.
One appendage at a time.
Yes, that's true.
Yeah, we'll take it.
Okay.
We'll take it. So we'll see you next time. And,
As always, if you have comments or you want to share a story of your own, put it in the comments.
Yeah, we'd love it. We love it. We love pictures. We love stories.
Yeah.
We've got an email address. We've got all the things.
Yep.
So, and get your preventive care.
Absolutely.
Yeah. So, thank you.
There's an old saying, I don't know where it came from, but if you listen to your body whisper, you won't have to hear it scream.
Yeah. And what's the other thing? An ounce of prevention
is worth a pound of cure. Yes.
100%. Awesome sauce.
All right.
Yay, good job. Thank you.
All right. Any educational or health-related discussions are meant for general information and entertainment only. They are not medical advice and are not intended as a substitute for professional medical advice, diagnosis, or treatment. Always consult your own healthcare provider for any medical concerns or decisions.
While we make every effort to ensure accuracy, we make no guarantees about the completeness, reliability, or accuracy of the information presented. Medicine is always evolving and content may become outdated.
The hosts and producers of this podcast explicitly disclaim any liability or loss incurred directly or indirectly as a result of the use or application of any of the content presented.
And most importantly, we laugh with our patients and coworkers, never at them. I'll make it record. God help us if we do a whole thing and we don't record it.
I know. Oh my God.
Because if we do a whole thing and don't record it and try to recreate it,
It would be different.
It'd be like improv.
Exactly.
All right, Nancy.